I'm Dr. William Hines. I'm National Medical Director of Behavioral Health Services for HCA Healthcare.
My name is Amy Towfighi. I'm a vascular neurologist. I'm professor of neurology and population public health sciences at the Keck School of Medicine of USC.
All post-stroke patients really need to be screened for depression. It is recommended in the early management of stroke, but the specific timing and the setting in which you do that's unclear. So you've got the neurological effects of a stroke, which can include, communication difficulties. You have the emotional lability that people often have following a stroke. These are barriers to the appropriate identification, often of depression in post-stroke patients. But the effectiveness of screening is dependent on appropriate diagnosis, management, follow-up. There's really not a gold standard screening tool for post-stroke depression. There's a multitude of screening tools that can be used, including what's called the Center of Epidemiological Studies Depression Scale, the 21-item Hamilton Depression Rating Scale. But probably the most practical to use for many people in most settings is going to be the Patient Health Questionnaire, which is called the PHQ-9. So screening instruments for people who may have post-stroke aphasia do exist. So there are sort of specialty screening tools that are used for that population, and they can include things such as the Stroke Aphasic Depression Questionnaire, which is the H10, and also the Signs of Depression Scale for if someone has aphasia.
A lot of clinicians just view it as just a natural response to the stroke and the disabilities that ensue. And very few health systems have robust screening systems in place with adequate referral mechanisms to ensure that patients receive the care that they need. So the first step is really broadening the awareness of clinicians and patients and their family members about how common and treatable depression is after stroke. And the second is really developing an infrastructure to be able to refer patients to get appropriate treatment.
And when you have a statistic such as 1 in 3 post-stroke patients have depression, it definitely, the balance weighs in going ahead and screening all folks post-stroke for depression, because the PHQ-9 as a screening tool, as I said, is extremely easy to give folks and gives you a pretty good indication of whether someone may have depression and whether it could be a moderate to severe case.